My name is Dr. Rakesh Rai. I am based at King's College Hospital, Dubai, and I am a hepatopancreatic biliary surgeon as well as I do liver and kidney transplantation. Today I am going to talk about a patient recently who was treated at King's College Hospital, Dubai. This is a surgical case. This kind of case is not very common, and it's very important for people to realize the way we need to approach these patients. This 50-year-old gentleman was referred to me from Kuwait. 1.5 years ago, he underwent a planned elective laparoscopic cholecystectomy. Unfortunately, there was a biliary injury. On table, it was recognized and it was repaired on table. So a planned surgery which was planned for maybe 1 hour extended to 5 to 6 hours. Post-op recovery was quite lengthy and complicated. He had post-op bile leak. He stayed in the hospital for 3 weeks and finally got discharged. For first 2 months, he had the biliary fistula. The bile was draining into his drain, and slowly it all improved and the bile drain was taken out. For next 1 month or 2 months, the patient was well and he almost went back to his normal life. But then he got his first episode of high fever and chills in Kuwait only, and he was readmitted. And that was the onset of cholangitis, which kept coming back. This cholangitis is basically you get a high fever, pain and chills because of a poor drainage of the bile into the anastomosis which has been created. So on investigation, it was realized that the reconstruction which was done had become narrowed, and that's how he kept getting on and off cholangitis. It was treated by putting a stent in place to dilate the anastomosis, which lasted for few months, and he had again a next episode of cholangitis. And that's when last year he came to us to meet our gastroenterologist, Dr. Farooq. And Dr. Farooq treated him further and he put a new type of stents which are not available in the market, and these stents, they last much longer than the usual plastic stent. He went back to Kuwait, did quite well for a few months, but again after 3, 4, 5 months he started getting cholangitis. At that time he was correctly advised that because he is getting these continuous symptoms, that probably he will need a revision surgery. Finally he made a decision to came back to us for this revision surgery. We anticipated surgery will be challenging because of already 2 surgery which was done, and he had multiple episodes of cholangitis that makes lot of adhesions and inflammation in and around the area of interest. Anyway, we studied the anatomy by doing his MRCP, and we already had pictures from his interventional radiology, and we planned elective surgery. Fortunately, he was free of cholangitis at that time, and we operated on him. It took around 3 to 4 hours, but surgery went well. As expected, it was a complex situation inside the abdomen because of the previous surgery and inflammation. There were a lot of adhesions, things were stuck together, and it was difficult to reach the area of interest where his previous anastomosis was done. And we have to be careful with these inflammation and adhesions because there are a lot of important structures like blood vessels which are very close to where the anastomosis is. So, there is always a risk of damage to these important structures. So you have to be careful about it. After surgery, the patient stayed for 12 hours in HDU and he was shifted to the ward. We had a drain in place just to monitor him for 2-3 days. And as he recovered without any complication, he made a remarkable and very fast recovery. We took out the drain on day 3, and by day 4 he was ready to go home. So his recovery was very quick. He was otherwise a healthy man, and he was discharged on day 5. Now it's a very short follow-up. He's just recently gone home. But I don't see any further problem in near future or even in long term. Sometime, maybe in many years, these anastomosis, they get narrow, but that's where the technical part is very important. If technically the anastomosis has been made in a way that it's a very wide anastomosis, hopefully it should never cause him any problem. We'll be in touch with him. He's going to follow us with us in a few weeks' time for the first follow-up. and we'll keep a close eye. But I hope long term he lives a completely normal life.